Good day, viewers at home. It's a pleasure to welcome you once again to another episode of Health in Focus. My name is Akelabi Toluwalashe, and today we'll be talking about arthritis. And with me, I have a doctor. His name is Dr. Ume Celestine, and he's a prolotherapist and also a pain specialist. You're welcome, doctor.
You're welcome.
All right, before we talk about the topic for the day, you said you are a prolotherapist.
Yes.
And a pain specialist.
Yes.
So tell us, who is a prolotherapist and why do you choose to be a pain specialist?
Okay, yeah. Prolotherapist is actually a doctor who uses prolotherapy. Prolotherapy is a treatment that regenerates a worn-off tissue of the body or repairs a damaged tissue of the body. So to proliferate means to rebuild or to restore by process of multiplying the cell or the tissue back to normal. So you use prolotherapy in treatment of, for instance, degenerative disease of the body, which usually happens in the joint, generally known as arthritis. And my interest in pain started at early days of my being a doctor, and my focus has always been to find solution for arthritis, which even up to now, many people believe that doesn't have a cure, because most of the treatment they take don't solve the problem. So discovering prolotherapy is more like the answer to my quest for a solution for arthritis. So we use prolotherapy in the treatment of arthritis.
Okay. So doctor, tell us, what is arthritis?
Yes, arthritis is actually, I usually call it an umbrella name. In fact, that's how it's defined. It's an umbrella name of more than 100 diseases that affect the joint. At the beginning, arthritis is a compound name made up of arthros and itis. Arthros has to do with joint, itis has to do with inflammation. So when you join them together, it means inflammation of the joint. But in recent time, we have realized that it's not just inflammation of the joint, it's actually degeneration of the joint, coupled with inflammation. So arthritis is two diseases in one, degeneration and inflammation. You understand? So understanding this is a key to knowing what to do when it comes to treatment of arthritis. Because if you treat inflammation without treating degeneration, you cannot solve the problem.
Okay. So are there types of arthritis? Or
Yeah, there are, as I said, arthritis is an umbrella name of over 100 diseases. So you have osteoarthritis, you have rheumatoid arthritis, you have fibromyalgia, you have what we call lupus erythematosus, you have psoriatic arthritis, you have juvenile arthritis, you have septic arthritis. There are many of them.
you mentioned like 7.
There are numerous of them, many of them. You have enthesopathy, all kinds, tendinopathy and all that. So anything that causes pain and dysfunction in the joint is actually a form of arthritis. Okay, but the commonest of them all is osteoarthritis.
Okay, osteoarthritis.
Yes.
So what does it have to do with osteo? Is there a particular part of the body that has to do with that?
Yes, there's osteoarthritis majorly affects the mobile joints of the body. Mobile joints, it can be the knee, the hip, so wherever you have two bones coming together, of course, that's the joint. But majorly where you have two bones so much approximated to each other, like in the hip, the knee, the elbow, the shoulder, osteoarthritis occurs there. So it can even have osteoarthritis at the neck, low back, because there's what we call facet joints there, which is where two bones come together. You understand? So because we have bone-to-bone joint majorly in the body, so osteoarthritis is the commonest. So the other arthritis affect the connective tissues like the muscles, the tendons, and all that. But osteoarthritis is the number one type of arthritis.
Okay. So let's look at the causes, because I believe before one could have a pain in a particular place, there should be something that triggers it.
Exactly, that
so what
triggers.
are the causes of arthritis?
Very important. Now, because it's difficult to pinpoint or identify a specific cause, we usually like to use the word predisposing factor. You understand? Which means there are certain conditions or certain things that can put the person in high risk of developing arthritis in general. Osteoarthritis commonly, you understand? So that can be, for instance, if you're a woman, I usually like to group it natural causes and unnatural causes. Natural causes is certain things you cannot do anything about. Number one, if you're a woman, women have arthritis more than men. So women have it 2 times more than men. If a parent has it, the likelihood of transmitting it in the children is there. So there's hereditary component to having arthritis. So if one's parents has it, one has higher risk to developing arthritis. Number 3 can be weight. If your weight is higher than your normal BMI, it will put you in a high risk. You understand? So other what we call immune reactions one can have, can predispose some. That one is due to body conditions where your body is now fighting against itself. What we call the rheumatoid arthritis, that can also happen. Hormonal issues, especially in women, can also predispose somebody to having arthritis. That's why arthritis is commoner in women that are entered menopause. You understand? Which you might have to explain later. Then, unnatural causes, which is more like accident of life, could be from trauma. You had a fall, you twisted your joint one time in the past, and nothing happened, and you felt good. But later on, you start feeling the pain because the tissues of the joint, like the ligaments and tendons, the cartilages, are usually very difficult to repair on their own. So it could also be your posture, how you sit, could be putting pressure on your joint. It can also be, the kind of work you do, that also puts pressure on your joints. Some people, they sit and leave mattress they sleep on can also injure your joint and all those kind of things.
Okay. So, doctor, since you mentioned earlier that women commonly have arthritis,
yes,
you mentioned that about the percentage of women are higher than that of men. So I want you to tell us why. Okay.
Yeah. There are many theories, I could use the word theory, that have been propounded as the reason, because nobody is completely sure. Okay. Number one is women are known, just as I mentioned weight before, women are known to have sudden increase in weight at certain stages in their life. When they're pregnant, after delivery, some people add weight and all that. And each kg of weight you add will put almost 4 kg of pressure in your joint. You understand? Number 2, genetic transmission. If a parent has, especially the mother has arthritis, the likelihood to transmit it in the female offspring is higher than to the male. So the genetic connection is more with the female. You understand? Okay. So as well as there's an estrogen that is known as there's a hormone that's known as estrogen, which is very protective to women. You understand? When a woman is young, still menstruating, the estrogen is fine. But when the woman goes into menopause, the estrogen drops. So the protective ability the protection the estrogen was offering also drops. And the woman develops high risk of. So at menopause, the risk of a woman developing arthritis becomes much, much higher than the male counterpart. You understand? In fact, there's also another hormone that's known as relaxin. That's the name of the hormone. That is said to be the hormone that increases when the woman is pregnant. What it does is to relax the joints, preparing the pelvic area for baby to come out. So it makes the joint to be a bit flexible and all those. So it's also that hormone, not only in pregnancy, is also known to be high during ovulation. So every month that hormone picks up. So it also acts on the ligaments and tendons of the woman. So it's found out that the joint of women is a bit not as stable, let me not use the word strong, as stable as the men's joint. You understand? So that instability also predisposed to injuring of the ligament and all that. Then fashion. Some women like to wear high heel. You know, habitual wearing of high heel. Yeah, the high heel doesn't only injure your ankle, it also injures the knee, the hip, even the lower back, because it changes your anatomical, frame whenever you wear it, putting pressure in one joint or the other. And some of the high heel you wear, when you are walking, you are not stable. Your ankle is so all these things put stress on the ligaments and all. So these are many things can be reasons why women have it more than men.
Okay. So you mentioned earlier that arthritis is about joint pain and all that. Yeah. So if I'm feeling pain in any part of my body, should I ascribe that to arthritis or is just another pain? Okay,
good question. Now, arthritis, just as I said, is both inflammatory and degenerative. In fact, arthritis is more of a degeneration, which means wear and tear of the tissues of the joint. If I have a fall, for instance, and I injure my joint and I'm having pain now, I won't call that arthritis. It's a pain due to trauma, which can clear at any point. But it's just that trauma may predispose me to developing arthritis later, especially osteoarthritis. So if the pain is not more than like 3 months, so arthritis is actually a chronic joint pain. So if the pain is not more than 3 months, it's not yet chronic. So you might not really call it arthritis. It might be something else that can easily clear. Okay. So, but when the pain, whether it's persistent or off and on, as long as it's more than 3 months in your joint, it is arthritis. So your approach to treatment will vary from the one that is less than 3 months and the one that's more than 3 months.
Okay. So you've just mentioned one symptoms now.
Yeah.
So tell us more symptoms of arthritis. What are those signs that we should look out for so that you know that one will know that he or she has arthritis?
Good. So as I mentioned, one is pain. Number two is what I call, there could be swelling. Some arthritis the joint might get swollen up and all that. Sometimes there might be no swelling. Then there might be, third one is loss of function. Loss of function is okay, fine. I could easily walk, go anywhere without giving it a second thought. But because of the chronic pain, I found out that I can't walk anymore. So you are losing function. That joint is not functioning very well. I can't climb staircase easily anymore. That's loss of function. Or I'm walking and the whole pain is radiating from my lower back to the back of my thigh. I have to rest. So that's loss of function. Then the worst is, especially when it gets to very severe stage, is deformity of the joint. You understand? So it can eat into the joint so much so that the joint begins to deform. Like as I have in the knee, I have what we call K leg, you understand, or bow leg and all that. Some people, it's arthritis that cause that, especially in the adults. You didn't have K leg or bow leg as a young person, but as as time goes on, you start having, apart from other things, arthritis is major cause of such a deformity. So these are the symptoms: pain, swelling, loss of function, deformity. These are the symptoms that you may have when you have arthritis.
Okay, while mentioning the types of arthritis earlier, you mentioned juvenile.
Yes.
Juvenile, I think that has to do with
children.
The children.
Yes.
So how can a parent discover if his or
a child has exactly when a child is depending on the age of the child, as we say, it can even be from age 0. Arthritis has no specific age. Yeah, in as much as one advances age, the risk is commoner. Older people have it more than children. But even at 0 age, what I mean by 0, when the child is not yet 1 year, there could be, So you are bathing your child and all that, and anytime you touch a particular joint and the joint grimaces or cries, shows signs of pain. You begin to wonder, okay, maybe it's not anything. The next day it happens, anytime I touch that place, it's pain. So it shows that something is happening in the joint. Some of the joints, sometimes you might have or start noticing that joint is getting swollen up and all that. So it can. So if it's a child that's already playing around, that child that can talk and tell you that I'm having pain here, and persistently complain of, if the child complains once in a while, it can be an injury or something. But when the child persistently complains of pain in a particular joint, you have to check it out. It might be.
That means for that kind of child, maybe it was passed to that child through the mother, or what? Because it's a small child, we can't really say maybe the child has gone through certain activities that
could lead to that. So maybe yes. Secondly, it could also be due to disease condition a child might have. There are what they call it. Some children that have issues with their hemoglobin. There's what we call a type of blood they have, that might begin to cause swelling in the joints, or like what sickle cell, anemia, and all those kind of things. So there could be some disease condition in the child that might not necessarily that it was transmitted from the mother or had an injury, but due to disease condition in the child. So that's why one needs to check out early enough and find out what's going on.
Okay. So for adults, are there activities that could trigger arthritis? Due to our profession, sometimes we need to sit from morning till evening.
Yes.
So, and there are some people, they do driving job and all that.
Exactly.
So they need to sit and drive. And some people maybe walking and all. So are there activities that could trigger, that could cause arthritis?
Definitely. There's something I call daily activities unknown to us that might be predisposing us to arthritis. You understand? Even the way you sit. So if I'm sitting and my head is not directly on my neck, and my spine is not directly on my waist, So what we call slouching. Imagine I like to sit and you slouch like this. Is you're putting pressure at your lower back. That's one. Number two is sedentary sitting. Prolonged sitting. There are some of us, prolonged sitting not necessarily only in the office. You you drive long distance, you get to office, you sit for long hours and all that. So you have to be sure that the seat, even in your car or in your office, when you sit, your low back is touching the backrest of your seat. There shouldn't be, you shouldn't put your hand and there's a gap between your low back and the backrest, because that will be putting so much stress at your low back. When you lift objects, you also have to have the mechanics of how to lift objects. So when you lift object, you bend over and carry a heavy object in front of you. You are putting so much stress at your back. The best thing is you have to squat. You understand? You have to squat so that when the essence is that you distribute your weight or the weight of the object you're lifting to your ankle, to your knee, to your hip and low back. They distribute the whole weight. But when you bend over, the whole weight is acting. Your knee is straight, your leg is straight, your low back is bent over. So you're putting so much stress at your low back. You understand? Sleeping position is been found. Some of us like to sleep with their tummy lying face down. Yeah. That puts so much stress at the spine. So the best sleeping position should be lying with your back. The many of us find it comfortable. You can lie by your side though, but never lying, with your lying with your tummy and all that. Okay? Yeah, those of us that are in sports, contact sports and all that, injuries that can come, these are the things that can lead to arthritis later on. If there's any infection close to the joint, you had a wound that's close to the joint that was not treated very well and gets infected, that infection enters into the joint and causes septic arthritis with time. Most of these things.
Okay, so let's look at prevention. So because some of us, we do the kind of job that if we are not careful, we get arthritis. Yes. So how can we prevent arthritis? At
a large extent, arthritis can be prevented. Number one, you have to watch out your weight. There's what we call your normal BMI should be between 18 and 24.9. The doctors will calculate it based on your height, because as a certain age, maybe at 25 years of age, you don't grow again. What changes is your weight. So your weight has to be commensurate with your height, which will keep your BMI within the normal range. If your weight is increasing by any reason, you have to work on it. That's the way to prevent arthritis. Number two, as I mentioned earlier on, don't do anything that puts so much pressure on your joint. Avoid it. Women, if they can, don't wear so much, high heel, exactly, that causes a lot of instability. It's fashionable, but it is also not healthy enough. You understand? Okay, just as I mentioned for weight, sedentary, you have to avoid sedentary lifestyle. How do I avoid it? It said for you not to be classified as living sedentary lifestyle, you should be having at least 10,000 steps, more than 10,000 steps every day. So,
can you explain
what that means?
Explain that.
Okay, fine. So, yeah, steps is, of course, I wake up in the morning, go to bath. Any step I take is counted. You understand? Any movement is counted as part of that 10,000 you should do in a day. You understand?
Doctor, I know it's not easy to be counting steps.
It's not easy to count.
So that means there should be a particular minute. Maybe
there's a particular, exactly.
Can you walk for 30 minutes, 15 minutes,
exactly,
for 5 minutes?
Exactly. So, like, if like every hour you are taking like 120 steps, over 100, like around 100 steps per hour. From there, I can now walk it down. Though some of us can buy this thing they call podometer. It's like a band on your wrist that can count your step in a day. So at the end of the day, instead of you racking your head to see how many count, because you cannot count, you can't keep count. So you have such a device to tell you how many counts here. Okay. So, but all in all, if you are the type that drive to work, whether you're entering Okada or bus and all that, you don't trek to the next bus stop. You just come into front of your house, enter Okada or whatever it is, drive, go to work and come back. You are practically living a sedentary lifestyle. You understand? You come back home, instead of you are sitting in front of television, reading newspaper or watching television, you are practically living a sedentary. You might not be getting up to 5,000 steps in a day. You understand? So in that case, you have to incorporate exercise in your life. And the exercise you should be doing, targeted to do like 30 minutes, every day or 5 days in a week. That will give you like any exercise that could keep you walking, anyone that you can do based on your age and your body fitness. If it's jogging, you can jog. If it's walking, you can walk and all that. But be up on your feet for 30 minutes every day. With that, you can cover that 10,000 steps in a day. You understand? Okay. Then your diet, you should be careful. The junks, you should avoid junks as much as possible, especially when you are 40 and above. Let your diet be more of natural food, plant-based food. It can be fruits, veggies, all those that come from plants. They're better than animal-based food like red meat and all that. Okay. So,
is there any other thing?
Well, basically it's all about fitness and also stress as well. Having a good
sleeping on the bed and having pillow on that, does it in any way could cause arthritis?
No, it doesn't. Just as I said before, if you are lying with your tummy, you should stop it. Number two, you should also be careful the mattress you are using. If it's very soft mattress that when you get up in the morning, you see indentation, a dipping, it means that mattress is not firm enough. You don't need necessarily orthopedic mattress, but it has to be a mattress that's firm that will keep your joints and your spine good. So when you sleep, if you like to sleep with pillow, which is also advisable, because when you lie, your head and your neck should be, and your low back, your spine should be like almost in the same plane. So if you are now using a pillow that's tilting your head up, that's putting stress on your joint. You understand? Or a pillow that sometimes makes your head to slant down. So it has to be more like straight. So putting a pillow that's always touching your neck when you lie down, not just resting your head. Your pillow should, that contour, that inward contour in the neck should be
a prolonged pain. As you said, maybe for some months.
Yes.
In Nigeria, we like to do self-medication.
Definitely.
When I people, you get rub rub it on you understand, the person might not know that he or she has arthritis. Yes. So when one discovers that he or she has a prolonged pain, so what should we do first?
Exactly. There's in medicine, there's always what we call first aid. Just as I said, when the pain just started, I can buy balm and be rubbing on the joints, buy some painkillers, because the first thing in my head is the pain. It's the pain that is actually what brings the patient to the hospital. But when you do that and the pain doesn't stop after 3 months, you have to investigate. You need to find out what's going on. And that's where people make a whole lot of mistakes. They continue to use what has not been helping, or they even increase the medication. They start going, when you go to the doctor continues to give you medications without finding out what's going on. You are not on the right path. So the next step is to find out what's going on by doing investigative tests like X-ray and what we call imaging test, MRI if the pain is in the neck or low back, and all that. So if you now do that, you now make a diagnosis. You find out whether degeneration has started or is about to start. If there's degeneration, I tell my patients, if there's degeneration in your joint, there's nothing to take by mouth that will stop it. You have to do regenerative therapy, which is where that prolotherapy we talked about comes in. So you do regenerative therapy to heal those degenerated ligaments, cartilages, and tissues of the joint. You understand? So that is the best way. Let me not use the word the only way, but more like the only way to revert arthritis or stop arthritis.
Okay, but can it be done in any hospital? Are there specialized hospitals?
It's actually a specialized treatment. It can't be done in any hospital. So it has to be a doctor who is specialized in such a treatment. You understand?
Okay, thank you, doctor, for that. This is how far we can go into this program, and thank you for being part of today's program.
Right done.
All right, viewers are going. This is how far we can go on today's program. But for arthritis, and on our next episode, we'll be discussing more on arthritis. My name is Akilabi Toluwalashe. Don't forget to watch the next episode. See you next week.